Hello, my name is Jason Aldred, MD. I'm a board-certified neurologist at Selkirk Neurology and Inland Northwest Research in Spokane, Washington. And today I'm going to speak to you all about Vyalev, a 24-hour subcutaneous therapy for advanced Parkinson's disease. My specific part today is going to be discuss in briefly adverse reactions that can occur with this therapy based on published data as well as my own experience using this medication. I've been involved with clinical trials for Vyalev since 2016 and have had a lot of use with that over time. Learned that with the successful troubleshooting of adverse events, patients can do quite well with this therapy when they're struggling with oral medications and having lots of off time. And it can be very meaningful to troubleshoot this. And a little bit of hard work at the beginning makes for a lot of improved on time later in the days, weeks, and months to follow, years to follow. I've had many patients on this for a number of years now. In short, there are three ways I think of side effects for Vyalev. One is the obvious, is the skin adverse events, and how to understand that well, prepare for it, try to mitigate it, and if they occur, how to quickly address that so it does not become a barrier to continuation of Vyalev therapy. Another category is neuropsychiatric side effects like hallucinations, which are not terribly common, but can occur. And certainly when we're using Vyalev outside of a clinical trial population, that is to be expected. In fact, not surprising to see that as patients are going to have other medications that are using with Vyalev that may affect it, as well as perhaps be more advanced. And the last adverse event issue is dosing and dyskinesia, things like that, which I'll touch on briefly at the end. So skin adverse events, or the one unique thing to a therapy, which otherwise has a lot of similarities to other oral therapies we've used in the past. The Vyalev is delivered subcutaneously 24/7 into the subcutaneous tissue through a thin plastic applicator. There's really three components of successful management, mitigation, and treating skin issues. The use of a small amount of alcohol for prep on the skin before the applicator is put on is important. I particularly in my patients just use soap and water, but most people use alcohol, and that's either fine. The area is not to be shaved or any kind of abrasion done to the skin beforehand. If that is the case, what we're doing is removing a healthy skin tissue that's actually necessary for a barrier. And so you don't want to really damage the skin or abrade the skin before you put the applicator on. And in fact, I've seen in talking to a lot of my colleagues that probably is the number one reason for failure for this, is the patient is either not instructed to just simply clean it, or perhaps just in best intentions is over cleaning it, or maybe instructed to over clean the area of the abdomen or other locations where it's applied. So you want to just use soap or water or alcohol, and then apply it over the area of the skin, clean it, let it dry off, and then apply the Vyalev applicator there. Now leads us to the next step, the applicator use. When Vyalev applicator is applied, if it is painful or hurts, if it feels like anything other than maybe a small itch, it should be removed. If there's any kind of pain afterwards, that means it's either gone too deep, or in some location where it's near some very small neurovascular bundle, something where it probably is not going to do well. The applicator should not hurt when it's put on. And if it is hurting right after the initial application, it should be removed. And then lastly, here for this type of skin and infection issue, remove this quickly if it's infected. How do we know if there's an infection? Well, if the applicator is on 1 day, 2 days, 3 days, anytime before it's removed, and it starts to become painful, that is a red flag. Pain is your friend, and being successful here. Anything other than just bumping against it and having it, just just remind you that it's there. If it starts to hurt, don't wait until it becomes red. Don't wait until it becomes swollen. Don't wait until it's hurt for several hours. Remove it right away. If you wait more than my experience is more than half an hour to an hour. If you wait long with it hurting or any signs that it's not working well, you're going to be at risk of having a major problem. This actually, in addition to the skin prep part of overdoing it, leaving the applicator in longer than necessary after there's a red flag for a failed infusion is greater than 90% of the reasons for problems with infections or abscesses or something like that. In my practice, I've given this advice directly to patients, and we really don't have a lot of frequent skin issues. They will happen occasionally. I like to tell patients when I sign them up for Vyalev that you will have skin problems with this from time to time. It's part of it's quote unquote doing business with this therapy. You have a trade-off of oral medications not being taken. So there is a maintenance of the skin that's required. And what I find that if I'm able to get my patients past the first 6 weeks of therapy, the skin issues that come up, they get better at them. Their issues early on are not issues that persist in the long run. And that is so important because for many people, they're struggling so much with their Parkinson's motor symptoms, they really do need another option. And I found this to be such a wonderful fit. Other issue with skin adverse events is this idea of pooling. Pooling is when the medication is infusing and the skin may become like lighter colored or based on certain skin tones, more whitish or something like that, or less blanched, less like healthy and kind of normal looking. And that is because the cannula typically is too superficial. If the cannula is too superficial, it probably means that you need a longer cannula, or it might mean that you need to move it to another location on the body. The human subcutaneous tissue is not the same depth at all locations. In the abdomen, it's a certain depth. On the flank, the side, it's a certain depth. On other locations, if you do pursue use on the limb, it's a certain depth, and it's not the same everywhere. And so, if you have a pooling on one area, where it seems that the medication is not going in all the way or something like that, you either need to look at doing a different length of cannula or moving it to a different location. So that's a bit of a pearl. And then the opposite of that is if it hurts when it infuses. If it's hurting when it's infusing, generally we find that it's too deep. And so a cannula that's longer needs to be used, a shorter cannula in that situation. Or, as I've just mentioned, move it to a different location on the body that's got a little different thickness of the subcutaneous tissue where the target of the medication is delivered.